So now we will be talking about the ill effects of the self-medication. Self-medication means taking any type of drug without any supervision of the physician or the medical expert. Now see, this particular medicinal drugs, they may have the side effects and it can be disturb the person's body system. Now see, if this particular, it is not like that if you are taking any type of drug it will just spoil your body system. But if any drug is taken without the professional advice means without the advice of any doctor or medical expert, it can harm, especially it can affect the children, then elderly person, people, sick people, then person those who are taking other drugs, means they are having the comorbidities like you can say BP or any type of diabetes or anything, and they are taking like that only any medicine. Person with any congenital abnormalities, note down the term congenital. Congenital abnormalities means the abnormalities which are found from the birth, understood? Then pregnant women, breastfeeding mothers, all this should absolutely avoid self-medicate as it can be dangerous for them. But it does not mean that others can take, those who aren't have any type of problem. Now see, this type of self-medication is been taken, we'll discuss later. But what thing uh, can happen after taking the self medicine? So first of all, this self medication will cause the addiction. Now it is not like that it is the drug addiction. Any type of drug, small headache you have, you will immediately take the, you will not be able to tolerate the headache. Immediately you will feel, no, I must take one combiflam or any drug with any type of painkiller, understand? Then the thing is, it can cause the in accurate doses that can lead to the accidental overdose. Now, the dose of a particular medicine is set up by your body. Actually, it is as per the weight. Ideally, some medicines are very ideal that 500 mg of the paracetamol can be taken by an adult. It is ideal doses, but sometimes it can cause the overdoses. Now, sometimes what happens that medicines have been mixed. Mixed means they are taking together, which we don't know. Two, three medicines, okay, ये हो रहा है, I will take this. This is happening. Two, three things, सर्दी भी है, जुकाम भी है, ये भी है. तो what we do, we take two, three medicines together. But that mixing of two, three medicines might be very dangerous for the person. So it is not safe to mix the medicines. Sometimes what happens that medicine, suppose a person is having the headache or constant headache every now and then, and that headache might be symptom of anything, or any major issue into the brain, or it may be the migraine or anything. But what is that person is doing, it is just suppressing or masking the symptom. It is, this headache was nothing but the symptom of that type of particular problem. But this self medication, if you will go to the medical expert, they will do the diagnosis. Now what we do, normally we say we will go to the doctor, doctor will ask 1,000 tests and all, unnecessary waste of money, they have commission, they will do this. No, actually it is not like that. Until and unless they will not test all the things, they will not come on the conclusion. If you will go to the doctor, you will complain, it is happening again and again, definitely doctor will ask you for the x-ray or relevant diagnosis. The reason behind all such diagnostic tests is that they want to come on the conclusion to design your medicine. So if you will take your medicine by your own, so that will suppress that particular symptom of serious condition, then sometimes it can cause the incorrect diagnosis. Suppose a person is having ulcer and all, this ulcer is been formed because of particular medicine, but you are just taking conclusion, wrong conclusion, so it can cause the incorrect diagnosis. It can delay the medical advice. Maybe you are having the brain hemorrhage and because of that you are having some problem, but what you did, you suppress the pain by having the painkiller by your own. So it may delay the medical advice, it can lead to the severe health condition, and self medication even cause death of a person. Now which type of self medication is usually taken by we? Most of the time people are taking painkillers without medical advice, and they say, "Arey, for headache we have to go to the doctor. Why? Take one painkiller, take this, take that." Actually this is something very wrong. Today I was having so much pain, I was having stomach pain, this and that, and I took painkiller. Why without medical advice? It can cause any serious issues. So the first thing we must know about painkillers. Yes, definitely painkillers are designed to relieve the pain, but taking them without physician's consent can put patient into the trouble. Now, what type of trouble can happen? It can cause headache, ulcer, dizziness, bleeding in the stomach. It can cause rashes, acidity. Acidity is most of the cases found in many type of medication. It can cause constipation, vomiting, nausea, diarrhea. Sometimes the if blood pressure patient will take, means the patient who is having the BP issues will take the painkiller without medical supervision, it can counteract the effect of blood pressure medicines. Means whichever medicine he or she has taken for the BP, that will be counteract, and it can cause cardiac failure. Understand? So this a simple mistake, this simple pain relieving can fall you in a very serious trouble. Now second medicine which is taken without advice most of the time is antibiotic, right? Only this will not do anything, take this antibiotic. Many medical experts are there in the home also, they are just saying, "Arey, most of the time when I go to so and so big doctor, he was giving this medicine, you also take." So this can also harm very badly, especially antibiotic. But before telling you about antibiotic, let me tell you students, in our body antibiotic is for what? It is drug which is designed to kill the bacteria. So sometimes the bacteria are very harmful for our body, but you know, in our body there are very good bacteria which are our friends. Means they help, they protect us from many things, especially the bacteria which are present in our intestine. They help or they aids into the digestion. Then we have some good bacteria in our mucus lining. So this particular bacteria, you all will not believe, will help us in maintaining, or they are helping to maintain our immune system. That means they do not allow the bad bacteria which are harmful for our body to reside there, especially in the case of the woman, their vaginal lining, it they have the good bacteria, and this particular good bacteria do not allow any harmful bacteria to enter, and they do not allow to make the harmful bacteria to reside there, make their own colony. Why? Because it is a competition, right? Good bacteria want to reside them, and this good bacteria are helpful for the woman health, and means they will not let other bacteria to reside there. Even if that good bacteria are clean off from the woman vaginal lining, it can means allow the papilloma virus to enter there. And you might be knowing this, the human papilloma virus, it can cause the cancer, right? Uterus cancer. So these good bacteria, in short, are very important for the woman health. So now This antibiotic, they are killing the bacteria. Our immune system fights against the bacteria. It is not like that bacteria are not been, they are simply coming entering in our body. But if it is good bacteria not harming to our body, it retains there and it helps, it supports the immune system. But when our body is unable to control any type of infection which is caused by the bacteria, so sometime doctor give us the antibiotic, but it does not mean that we take the antibiotic every now and then. But if taken in inadequate dose, so what will happen? Again and again you are taking azithromycin or any type of antibiotic again and again without any proper dosing and irregular interval for incomplete duration. So what will happen? That particular bacteria will become resist. Suppose if it is a 3-day dose, see, be very particular with the antibiotic. Even if it is given by your doctor, what we do, a second day I'm feeling very well, there is no need to take the third dose. It is absolutely wrong. Whatever dose is prescribed by your doctor, it is to set up your immunity, especially in the case of antibiotic. If it is inadequate, so what will happen, that inadequate dose, incomplete dose will make the bacteria resist. So yeah, one must take, if it is given 3-day dose, definitely take for 3 days or whatever 5 days and so on. So there is a need sometimes in the severe cases like the torch infection and all, doctor gives 21 days dose, and they says that it is very compulsory to complete the dose. That means they, that is important for setting up your immune system against that particular bacteria, and that bacteria takes the 21 days to clean off from your body. So whichever dose is given by your physician, you must definitely follow that and complete the dose, especially in the case of the antibiotic, or else your body will, that bacteria will settle in your body and will become resistant. So next time whenever you will take that particular antibiotic, that antibiotic will be ineffective for that particular bacteria, understand? So now see, if bacteria will become resistant to the drug, so what will happen? No medicine will affect, and that bacteria will become more and more powerful in your body. Now, what could be the side effect? First of all, don't dare to take any antibiotic without medical supervisor's advice. But if you will take, what side effects will be happening? It can cause vomiting, loose stools, nausea, dizziness, swelling of lips, face and tongue, as well as the vaginal infection. As I told you, that vaginal lining is having lots of good bacteria, so that bacteria will be killed, so it can allow the growth of fungus in particular area due to suppression of the good bacteria. So this is all about the self medication. Now see, as far as the health part of this particular unit is there, it's ended here, and from the next lecture onwards, tomorrow we'll start about the water and water supply. So this is the next part, because as you all know that the name of unit is public health and hygiene. So next lecture onwards we will be talking about the water.